Hi, this is Dave Kading from Seattle, Washington. And one of the challenges I think we experience in our practices is how do we use technology to give the best patient care that we can possibly give. So I have soon to be Dr. Gabe Fickett here with us, who is an intern with us right now and has done some interesting observations on some technology in our office. Gabe, what are you going to tell us about today?
So I'm going to tell you about the use of different technologies that you can implement in the care of macular health.
Okay. So Gabe, give us a little bit of a breakdown of each of these technologies.
So this here is the OptiView instrument, and this newest iView one has a really useful feature called the Eye Wellness Scan. It takes just a couple seconds. It's easy to do during pre-testing, and it gives a lot of useful information. It gives you a retinal thickness map for each eye. It gives you the ganglion cell complex breakdown for each eye, and then also gives you this cross section. So they're useful for different things. The cross section, you can catch early drusen, early traction, those sorts of things. The GCC will tell you some info on early glaucoma, and then with the thickness map, you can catch subtle edema and those sorts of things. So this is the Quantify instrument from Zia Vision. This lets us know basically the density of those macular pigments that can protect macular function and macular health. So it just real quick takes a couple of minutes for the patient to run through it, clicking a button when they see the light, and it gives us an idea of whether or not we need to add supplementation to their diet to make sure we boost those levels of pigment to protect their macular health. So this is the Optos imaging system, specifically the Daytona instrument. And it has a really useful autofluorescence for macular health, and it obviously does it throughout the retina as well. But at a basic level, autofluorescence is looking at the RPE. Bright, hyperfluorescent means sick RPE, black means missing RPE. So a normal image should look like this with sort of the gray RPE layer you can see throughout. If it's hyperfluorescent from something like a toxic maculopathy, you'll see that right away. And then also if there's areas where there's just atrophy, that'll be gone as well.
So as you can see, there's a lot of really interesting things that we can learn from this technology. Gabe, how would you take away, what would you take away, and how can we utilize these in our practices?
So ultimately, as you can see, they're all useful in different ways in diagnosing early macular disease. So it's just kind of whatever works best in your practice in implementing this technology.
Perfect. Thank you very much, and thank you for joining us.